Hi everybody, my name is Colleen Pennington. I'm a labor and delivery nurse. I'm here to give a brief discussion about safe staffing. So everybody here is nice going to talk about safe staffing and it's good for quality patient care, but what does it really mean? The bill is Safe Staffing for Quality Care Act. So what it involves is acute care facilities to implement direct care patient ratios in all nursing units and minimum staffing requirements. And it requires facilities to have that to operate. It also gives nurses legal litigation if there's a minimum staffing standards and their assignment is above that. So currently California is the only state that has minimum staffing requirements. There's 7 other states that have committees to guide staffing ratios, but California is the only state that has minimum staffing standards. So I support this bill. In this brief presentation, I'll give you key points on why this bill is essential for quality health care. The bill supports standardized staffing ratios. So in the past 12 years, I've worked in a variety of different patient settings, from labor and delivery, maternity care, rehabilitation, and assisted living. In each setting, the nursing demands are different, but with higher patient ratios are increasing as healthcare changes. It is known throughout the healthcare industry that nursing is the heart and nuts and bolts that make healthcare run. So how can an engine run safely, removing a few bolts? Nursing ratios have been shown through research and patient outcomes to have a direct relationship with quality patient care. Staffing ratios influence medication safety, patient falls, patient satisfaction, and nurse retention. Nurses are expected to take on even more responsibility to care for the whole patient, promote healthy living with higher acuity patients and with fewer nurses. In 2005, California increased their assistive personnel by 64%, standardizing nurse-patient ratios, and they didn't lay off any caregivers. Nurse burnout is 58 to 76% more likely to occur with higher patient-nurse ratios. So put the shoe on the other foot. Would you want a nurse taking care of your loved one who is burnt out, who has a high patient census? Probably not really, but how would you know? Minimum staffing standards in some specialty areas and patient situations can mean the difference between life and death. One of my personal stories from my experience with minimum staffing and lack of standards, I was on staff in labor and delivery one night. There were 3 labor nurses with 1 outpatient and 3 postpartum patients with 1 postpartum nurse. At change of shift, we received a call from the emergency care center that an EMS crew had been sent out for a preterm patient who was bleeding. The description was vague. There was no patient identifiers. A half an hour later, the patient presented to the unit in critical condition, needing blood transfusions and an emergency C-section to deliver her preterm baby. In this situation, there were 2 emergencies: maternal stabilization and neonatal resuscitation with stabilization for a micropreemie, both requiring a multitude of providers for their care. If minimum staffing policies were in place and guided by laws, then patients' risk of morbidity and mortality would decrease, like in this emergent case. This bill is critical to our patients to entrust safe quality care by healthcare providers and increase nurse retention. Can I count on your support for this? I will leave you with a few key points to focus for this bill. Minimum staffing ratios increase patient safety, patient satisfaction scores, increase patient outcomes directed by increased nursing staff at the bedside, and decrease nurse burnout. It is a necessity to increase nurse retention. What is healthcare without nurses?